Welcome. Today we are going to talk about vitamin K2. My name is Dr. Elena Klimenko. I am a functional medicine internist in the Midtown Manhattan, New York City. So we're going to talk about vitamin K2, the essential vitamin that is insufficient in our body. Usually it is because we don't eat the food that contains a lot of vitamin K2. So let's jump in. And we're going to talk about, this is their agenda for today's date. I would like to speak about what is vitamin K2, how is it different from vitamin K1, for example, and what are the sources of vitamin K2? Can we make it in the body or not? What are the functions of vitamin K2 in the body? How can we supplement it? Is it safe? And what else you need to do to stay healthy beside the vitamin K2. So vitamin K2 is just one little pearl in the mosaic of our health. And then I'm going to go over some of the announcement, what's new in our practice, because these events usually attract patients or new clients. So it's good for both people to know, both type of patients or potential clients. So what is vitamin K2? Vitamin K actually in general is the family of the fat-soluble vitamins that come in the multiple forms. As you know, we have 4 fat-soluble vitamins: vitamin D, vitamin K, vitamin E, and vitamin A. So it's really interesting that sometimes when people are deficient in some fat-soluble vitamins, they actually deficient in all of them. So I like to test all those 4 fat-soluble vitamins, but back to the vitamin K, it is a family of fat-soluble vitamins, and it presents in the multiple forms in the body. So the first form that was discovered many years ago is vitamin K1 or phyloquinones, and that's their vitamin that is necessary for blood clotting and for coagulation. So if we have a trauma and we need to stop bleeding, vitamin K1 is essential for that. And actually, back in the days, we used to use vitamin K1 form to stop the bleeding, especially for women who continue to bleed after their period. Just 1 dose of vitamin K1 and the bleeding stops. But later on, the vitamin K2 was discovered. It's called menaquinone, or sometimes they use the abbreviation of MK. So the vitamin K2, as you can see, structurally, it's different. It has that longer tail. And what vitamin K2 is important, not in the blood coagulation or clotting, but more in the bone mineralization and inhibiting hardening of the coronary or the arteries in the body. So we have multiple form of the vitamin K2 or menaquinone. You can see in our supplements as a vitamin K2 MK4 or MK7. So actually all of those forms from 4 to 10 exists. And it's all that number is determined by the number of the isoprenoid units that are attached to that tail. So why is it different? Because we'll talk about it more, but here's an interesting fact. 40% of our population is vitamin K insufficient. Maybe not deficient, but insufficient, which is, there's a difference between deficiency when you're outside of the normal range, but insufficiency is when you're outside of the optimal range, okay? And as you can see, this beautiful picture of green leafy vegetables, a lot of our K1, vitamin K1, not K2, exists or presents in the food sources, like green leafy vegetables. And still, people are deficient or insufficient. So what are the sources of vitamin K2? There are different types of vitamin K2, but the long-lasting and most effective form of vitamin K2 is that MK7, because it has those 7 units. Right here on your screen, you can see that the long tail of MK7, which is very different from AK4 and vitamin K1. So K1 is here, and K2, the different form of from 4 to 7 are here. The half-life is a very interesting phenomena or term that you need to understand. It basically means that if you take it internally, 50% of it will be metabolized in a certain amount of time. So that's what half-life means. So half-life of the vitamin K1, your green leafy vegetables that you eat for lunch, in 4 to 8 hours, depending on your metabolism, your liver, your gut, will be gone. 50% of it will be gone. With MK4, which is a very common supplementation form of vitamin K2, the half-life is very short, from 3 to 6 hours. That's why if you decide to take K2 in the form of MK4, you would need to take it twice a day at least. But MK7 is the form that has a really long longevity. The half-life of MK7 is anywhere from 3 to 4 days. So it's much longer. So the sources of vitamin K2 are not really many of them. And the Western diet, historically, is deficient in vitamin K2. Why? Because the richest food that is rich with vitamin K2, especially K7, is the Japanese fermented soybean, natto beans. And if you tasted it, it has an acquired taste. Because it's fermented, it's really pungent and it's kind of stinky, like a fermented vegetable. So this is the richest source of food. But this graph that is taken from their nutritional research, as you can see here, shows the variety of different food that are on the axis. You can see the variety of the vitamin K1 that is depicted in black, or K2 that is depicted in the blue color. And you see that in the fish, the vitamin K1 and 2 are minimum. Milk, somewhat, there's something in there. Some fruit, meat, margarine, something that you probably don't want to eat. Butter, another, definitely another dairy. Cheeses, and especially aged cheeses. And here we see a really nice spike. In the vitamin K1, the green vegetables are definitely leaders. But natto beans provide a huge amount of vitamin K2. So this basically scientific research that shows which food contain it. But we know that vitamin K2 mostly present in natto beans, especially MK7, aged cheeses, but also your egg yolk, liver, either chicken or beef or bison. I love to eat bison liver that I buy in my local farmer market, and dark poultry like chicken legs or turkey legs, or even ostrich meat if you're interested in some exotic meats. And of course, fermented vegetables. So if you can incorporate those on a daily basis, that would be definitely a great support to your vitamin K2 level. Interesting, can the body actually synthesize vitamin K? And the answer is partially yes, partially no. Vitamin K1 can be synthesized, but must come from the food mostly. But K2, body can convert some K1 into MK4. Remember, MK4 or menaquinone, vitamin K2, is a very short living, only 3 to 6 hours. And it's usually that conversion happens in the tissue, in the brain, in the pancreas, sometimes in the arteries, and in the ovaries or testes, gonads. So other forms of vitamin K2, like MK7, that is long living, produced by the gut bacteria in the colon, but absorption may be very limited. And I do this micromineral analysis on many of my patients. MK1 usually is okay, somewhere in the border, but MK2 often is deficient. So because we produce some of that MK7 or MK4 forms of vitamin K2 in the gut, we can't really always absorb them. And it requires healthy microbiome to convert K1 to K2. So the practical takeaway, some production does occur, but dietary vitamin K, especially K2 rich food, may still be important to supplement for your bone and vascular health. So just keep it in mind that we probably still need supplementation. So what is the function of vitamin K2 in the body? We know that K1 can help with the clotting, but what does vitamin K2 does? So it activates the proteins, two major proteins, matrix GLA protein that you can see here, and the osteocalcin protein. Both of these proteins manage or regulate calcium metabolism and functions of the calcium in the body. Interesting, the matrix GLA protein actually blocks or inhibits calcium deposition in the arteries and soft tissue, therefore keeping our arteries clean and preventing progression of atherosclerosis. As you know, the calcium deposit into the arteries is the hallmark sign of the atherosclerosis. So having enough vitamin K2 protects our arteries from hardening, protect the arteries from accumulating the calcium. But osteocalcin has an opposite effect. It actually directs the calcium directly into the bone, making them stronger. Okay, so that's why K2 is very important. So what are the other functions of the vitamin K? Besides hardening, prevention of the hardening of the arteries by inhibiting calcium deposits and improving the bone mineral density, it also supports the brain health, and it also improves the symptoms of peripheral neuropathy. So some patients with the peripheral neuropathy should be evaluated for the sufficient amount of vitamin K2. It also has an anti-inflammatory effect, antioxidant effect. It increases cell energy production, improves the insulin sensitivity, and this is a very interesting fact, it reduces all-cause mortality, meaning that total mortality, total amount of deaths will be lower when the vitamin K level, K2 level, is within normal limits. So that's why it's so important. There are many different nutrients associated with the reduction of all-cause mortality, but K2 is kind of was a news for me when I learned that. So who needs vitamin K2? Well, actually, everyone needs vitamin K2, anyone from infants to the senior age, and daily requirements of vitamin K2 obviously depend on the gender as well as on the age. So older we are, more we need. For women, it's anywhere from 90 to 180. For our gentlemen, it's from 120 to all the way to 190. So keep it in mind that it varies. So we do need it, especially for people who have already conditions like osteoporosis or osteopenia, cardiovascular disease, diabetes, chronic kidney disease, peripheral neuropathy that I mentioned. They might require even higher vitamin K2 levels or supplementation. Interestingly, the vegans and vegetarians, because they do not consume that vitamin K2 rich food like liver or eggs or brown meat, unless they eat natto beans, would require a higher supplementation of vitamin K2. Interesting fact that, Japanese culture consists a lot of the natto beans, and their cardiovascular mortality is much lower. And some scientists, the researchers, link it to their fact that their arteries are not as hardened because the K2 in the natto beans is much higher. So the consumption of vitamin K2 is much higher than in the Western world. So are the vitamin K supplementation safe? Yes, it is safe. There's usually no side effects reported. And vitamin K2 does not interfere with the blood clotting that we worry about with vitamin K1 when people take certain anticoagulants like warfarin. If you know, people on warfarin or Coumadin usually are advised do not eat green vegetables, but it's actually not true. They can eat green vegetables that consist of vitamin K1. They just need to be consistent with the same quantity. If you eat 1 cup of green vegetables that contain certain amount of vitamin K1. The dose of warfarin or Coumadin should be adjusted for that amount, but patients are obliged to eat the same amount every single day. But vitamin K2, because it is not interacting with anticoagulants, or it doesn't convert to vitamin K1, and it's not participating in coagulation mechanism, usually is very safe. However, I would still advise you to speak with your practitioner if it's safe for you in your specific situation to take K2. So what else can we do to stay healthy? This is, after all, health-oriented webinar and educational event. So, of course, vitamin K2 alone is not going to make us 100% healthy. We need other vitamins. We need other nutrients, minerals, bioflavonoids. We need good fatty acids like fish oil and probiotics. Remember that supplements do not replace a healthy lifestyle and a healthy diet. Recommendation should be always personalized, and that's where the functional medicine shines, because it's not one size fits all. It's very personalized, and if you become a patient of our practice, you will see how much personalization we practice. But this bundle right here on the right will give you 3 essential nutrients, and you can shop in our e-store and get the discount for this 3 great supplements, which is Super Omega. 1 capsule gives you triple dose of omega-3 fatty acids. Your Powerhouse Multi gives you multiple nutrients, vitamins, minerals, and some other very important nutrients for their healthy immune system, and of course the probiotic. So if you're not a patient of our practice yet, but you're interested in functional medicine program and understand the patient journey, this is what happens. You'll schedule your initial visit, initial intake that usually lasts for 90 minutes, from hour and a half to 2 hours. At the end of that discussion and the nutritional exam that we do the testing ordering. Sometimes we order conventional blood tests, but sometimes we order specialized tests to look at your to your microbiome, maybe look at your micronutrients, maybe check your hormones, whatever is required in your story. We evaluate and discuss your lifestyle and supplementation intervention. You schedule an appointment with a health coach that will see you twice before your follow-up. We give you some resources for homework. You learn by reading or watching the videos. Then we schedule a follow-up appointments, which is usually in about 6 to 8 weeks from your initial visit. And we discuss the test and the progress of those interventions that were prescribed. And then we'll do the periodic visits to evaluate and to assess the progress of your journey. So that's basically what you can anticipate if you schedule a first visit. And I just want to present our probably bestseller, because this product is flying off our shelves. It's a vitamin D3 at 5,000 units and vitamin K2, specifically MK7, the one that is long lasting. So you need to take only 1 capsule a day, and it works, as you remember, it's not just supporting your bone, but it also protects your arteries from hardening. And also very important to keep a good level of vitamin D to keep your immune system healthy. Also, remember that we need vitamin K that we get from the green vegetables. Not everybody eats sufficient amount of greens. That's why I created this product that is a fabulous greens. 1 scoop of this powder a day basically replaces your big green salad. I recommend to still have a green salad, but sometimes you don't have time or availability of the clean organic greens. That time you can replace it and have this antioxidants filled beautiful fruit and vegetables in your diet to keep your diet balanced. Of course, the probiotics are very important. If you remember, the K1 can be converted to K2, but you need those beneficial bacteria. So the 6 biotics is the 6 probiotics that are all clinically studied and all do have beneficial effect on your health. So excellent probiotics with 6 beneficial bacteria and 1 beneficial yeast, Saccharomyces boulardii. Excellent probiotics, really has multiple application. I always have it in my refrigerator. I can take it daily if I have some gastrointestinal distress, or take it periodically when I need to. And I do encourage my patients to have probiotics on standby, or as I said, your first aid kit. There's a few things that should be there, and probiotic is one of them. So definitely keep probiotic on standby. And of course, February today is the last day of February, but it is a month of cardiovascular health. So if you want to support your cardiovascular health, we prepared everything you need for your healthy arteries and for your healthy heart. And this is the bundle that you can find in our e-store. Use that code HEART15 to get a 15% off on this bundle. And of course, the trio bundle that I mentioned earlier, also an excellent way to stock up for essential trio of omega-3s, powerhouse multi, and vitamin D3 and K2. So this is a good code if you want to fill out the wellness questionnaire and schedule a discovery call with us. You can get multiple sources of information related to our practice, either on YouTube channel or on Instagram. Please follow us and see what's new. So if you're interested to become our patient, take a next step. Schedule the discovery call with my team. They will explain to you in detail, step by step, what needs to be done to become healthier and to how to schedule an appointment. For those of you who are in Florida, or if maybe you have a family in Florida, I do see patients in Florida every other month at this point, and it's a beautiful place right on the beach. It's called Sunny Isles. Lots of my patients moved to Florida during their pandemic, so now I'm going there to serve them. And there's a really good news. We have this new therapy that we offer to our patients. It's a photodynamic therapy. It's a basically low level light laser therapy that is helping our body to be stimulated and increase the energy production, oxygenation, reduce the inflammation, improve immunity. So if you know about the red light therapy and the benefits for the health, we now deliver it intravenously, which is a great way and much more efficient way than just sitting on the red light or being exposed externally to stimulate your energy production, fight the fatigue, and improve the oxygenation of your body, improve their aerobic metabolism and physical performance, and most importantly, reduce the oxidative stress, which is equivalent of rusting, human rusting, right? If the metal rust, we as human oxidized with the oxidative stress, and this therapy will protect and rejuvenate your mitochondria that is the culprit of aging. If we can just keep our mitochondria healthy and discard the old one and produce the new one, we can live for much longer than we live now and much healthier than we are as a nation. Remember that the gut wellness is the essence of our health. Gut connecting all other systems in our body, including our brain, including our immune system, our hormonal system, our structural health, all binds to the gut. That's why I created this program to educate patients and educate people everywhere about the importance of gut. So this program will help you to learn and kind of understand a lot, and maybe even start implementing things on your own without functional medicine practitioner. What can you do now, today, tomorrow to improve your gut wellness. So don't walk by it. We now have a 50% off on this program. Great way to help yourself. So if you want to join the program, you can screen shot, take a picture of this QR code on the screen, and you can join the gut wellness program with us. So remember, we are offering IV therapy in our office. So if you are interested, we can for our patients, we offer 25% off on the first session. And there's a variety of different IV therapies that we offer. They're all physicians grade. They're not just, you know, like a street level bar IV bars that are opening up now. It's really science based, and with the therapeutic quantities of their of the nutraceuticals in the IV bag. For those of you who already are my patients and know about this genetic test 3x4, please join our free session on March 23rd. It's going to be led by our genetic expert, Marina Kucher, who is a functional medicine practitioner as well. And it's going to be next session is scheduled for March 23rd from 12 to 1 p.m. So book yourself a lunch spot and join us with your lunch and learn about your genetics. Oh, very helpful for many of my patients. And of course, we're still open for the new patients. If you have family members or friends who can benefit from this kind of approach, feel free to refer them. We really appreciate your referrals, because friends don't want friends to go to the bad doctors. We want our friends to be with the best doctors. So, and with that, I thank you for your participation. Thank you for joining me today.